I wanted to pivot a bit more to more kind of technical questions around specific things that patients with IBD should be considering and thinking about. And Julie, I have a question for you is around patient support programs, and just how are the patient support programs evolving now to help patients with IBD during this pandemic?
Well, the patient support programs are still operating, just due to volumes of calls and emails and that sort of thing. There may be some delays, but they're responding to questions and to concerns. They've always been a great central source of information and education. And if they don't have the answers, they will help you find them, whether or not that's something within their field or reaching out to some of our other partners and all these different companies that are working together, and making sure that we all have the most up-to-date information. And the patient support programs are also helping with things like screening of the patients, as well as rescheduling, like depending on the situation for that particular patient or their exposure or risk and that sort of thing, is helping to coordinate another appointment for them as soon as possible within the guidelines for their particular situation.
Excellent.
And maybe I would just add one comment to that about something else that they're doing that I think is meaningful is patients that are on injections that could maybe move to self-injections and not actually come into the clinics. The patient support programs have been very valuable in starting those conversations so that we as in the clinics and the nurses could train patients to self-inject, which might be a great strategy going forward in the next couple of months.
That's a great comment, Noreen, and I would even expand on that to say that I think most of us are all working on virtual strategies, and so virtual injection training is another way we're looking to support patients. We're kind of seeing a shift to those who can do a virtual injection training, do it that way, and it allows us more capacity in clinic. So I think that we're looking at doing things differently, and it's kind of pushed us into innovating, but I think it's great.
Yeah, and I would just add that for those patients who are on a biologic and you've interacted with your patient support program for years and they've helped in so many different facets, this is just another way that they can help you, is that if you have questions or concerns, you can reach out to them because they have all of the standards policies. They know exactly what's happened, and if there's a question they can't answer for you right away, they're going to find those answers for you, and they can be your kind of primary gatekeeper, particularly if there are challenges that may arise during the pandemic.